So, as I said before, last night we had a training session with Griselle Vanessa from National Family Voices, talking about what is a medical home. She did a wonderful presentation that will be available. You can watch the video, or you can get a PDF of the PowerPoint, and some of the stuff that she discussed we will talk about today as well. But we are going to just expound it a little bit and talk about your experiences as a family or professional living and working in Delaware. Just some housekeeping. We are the Parent Information Center of Delaware. We have been here since 1983. We are statewide. We work with all families throughout the state in all 3 counties. And our mission is to improve health and educational outcomes for children and youth by empowering them, their families, and the professionals who serve them. So we do this in a variety of different ways with lots of different programs. So we do one-on-one consultations with families and caregivers, learning opportunities such as this. We have online resources. So if you have not, please check out our website at picofdel.org, PICOFDEL.org. And then we also work in outreach and systems advocacy to make changes in legislation and policy for our families and children throughout the state. So today we're going to talk about a medical home. You should be able to define what a medical home is at the end of this, learn important components of a medical home, name some skills needed for you to become an effective advocate in your medical home, and then just identify one action that you can take to make a difference with this information. As we said before, if you have any questions, concerns, please raise your hand or put it in the chat, and Jaleesa is monitoring our chat today. So what is a medical home? So a medical home is an approach to the delivery of primary care. That is, it's patient-centered, comprehensive, coordinated, and accessible. And it is committed to quality, okay? So we talked last night a little bit about this. A medical home is not an actual place. It is a concept. It is a way of delivery that we would like to see in all medical facilities in Delaware. Right now, there are some examples in Delaware. We would like to see most or all systems move towards this kind of care. So the reason that we like and advocate for medical homes are because family engagement and family-centered care are extremely important pieces of the medical home concept. So parents and caregivers, as we know in education, in all other aspects, are the people who know their child best, and therefore they should have an active role in their child's health care. Does anybody have any questions so far? Okay, so let's talk about, you see the importance of a medical home and you would like to set one up. How do you go about that? So you have a child or a teen with significant healthcare needs. How would you go about setting up this medical home? Does anybody have any ideas about how a medical home would be set up, or have you set up a medical home and can give some insight?
Hi, I'm Kathy. Can you hear me?
Kathy?
Yes,
Yes.
I have no knowledge. I had no knowledge of a medical home since before the meeting yesterday. But it seems like I really love that idea of having a notebook of all your resources in one place, and I really strongly feel that uh, early, the earliest possible intervention is the best. But sometimes parents don't even know that. I don't know. I feel like there's like this gap somewhere between the parent knowing this and knowing to set up a medical home and knowing either their child has a real problem or knowing what the problem is. So I feel like the medical community uh, needs to step up and sort of become more aware of things at an earlier age, I guess. I don't know if that's even possible. So, step out.
Yes, exactly, Kathy. So I think there are a lot of families in your situation who recognize the need for a medical home, um, understand the concept and are looking for that, but don't know exactly how to make that happen, and also wanting that to be for medical professionals to understand it and begin to set it up. So it is a process that requires the cooperation of medical professionals. So we are going to look at how other states have set up medical homes and what advice or information they can provide.
You're muted.
So a medical home is not a place. It's a relationship with a primary care practice, a place where you go to get coordinated, comprehensive, accessible, family-centered care.
It means a doctor who's willing to coordinate all the different medical needs through specialist forms, reports, sharing information, and best of all, somebody that you didn't have to re-explain every time you walk in the door.
So a benefit of a medical home is that it's a planned relationship. It tries to anticipate what your needs are and helps to meet those needs. Someplace where everybody knows you and tries to help you. A place that helps to coordinate the care that you get with specialists and with community resources. And there's lots of barriers for doctors in providing a medical home. So one of the biggest barriers is lack of education. So doctors aren't necessarily trained in how to be a good medical home. Another problem is time. So doctors feel a lot of pressure to see a lot of patients to get everybody's needs met. And so they don't always have the time to spend with kids who need a little bit extra time. And then reimbursement. So doctors are on a lot of pressure to run a business, and it can be difficult to spend enough time with the patient if you're kind of feeling that business crunch.
Some doctors simply are not willing to be a medical home or to do the work that's needed. However, I want to encourage you because there are many doctors who do. To encourage my physician to become a medical home, I ask them, what can I do to make your job easier?
I think you go to your most trusted medical professional, whoever that might be. So that might be the neurologist, it might be the general practitioner, it might be an eye specialist, whatever, and say, we really need coordination here. And we need somebody that will be open to us, take our phone calls, listen to us, work with us closely.
So most families find doctors are good medical homes in a couple of ways. So one is making sure that you're connected with other parents of children with disabilities. So know who has a reputation in your community, in your neighborhood, for providing good medical care for children with special health care needs, and who's not afraid to provide that kind of care. And then second is working with your insurance company. So insurance companies have a rough sense of who's available, who's comfortable dealing with special health care needs, because they get that information when doctors provide bills.
I was just had this feeling that I didn't know how to help Will and how to build in some kind of structure or method for keeping on top of these crisis issues and this chronic medical issue. So I feel like the medical home has given us a safety net.
So what did you think of that video and that explanation about a medical home? Did that resonate with you? Did you have questions or comments?
It's Kathy again. I hate to keep it. No.
Go ahead, Kathy.
Okay. I hate to be the only one talking here, but I just felt like I really loved what they all said. I thought they were very direct and spot on with their comments. And it made me start thinking, like, I thought PIC was a really wonderful resource for us, but I came upon it too late. Like I feel like they were very comprehensive in what they could have helped us with a medical home, but we didn't hear of them until our son was like maybe 12, 13. And then by then we ended up sending him away for a period of time to kind of like boot camp place. So I feel like maybe the outreach of PIC could be very essential. Like this summer, I helped Jen Aaron, who just got hired by PIC, to do something with COVID vaccine kids with special needs. But we ended up doing a lot of talking about PIC itself. And there are so many people out there that never heard of it, but wanted to know more about it. So I feel like the outreach part of PIC is really valuable.
Thank you, Kathy. I agree. I mean, I think that like everything, PIC has grown. So we started as a PTI, a Parent Training and Information Center, as our main focus, which is working with families of children with disabilities in educational areas. And we have grown a lot since then. Now we also have Family Shade, which is the program that runs this program, and our Family Leadership Network. We also have Delaware Family Voices, which works with families. And later on, I'm going to talk about these programs specifically, but we now reach into a lot of different areas. And I liked in the presentation, in the video, where it talked about one of the best things you can do is to talk with other families of children with disabilities. And that's really what we know, is that building community is the way that you can really advocate for your children. Because as you said, then you're connected, hopefully early enough, to really make a difference for you and your family. We also prioritize our work with early intervention, and even in pregnancy and birth, we are working with families to talk about advocacy, so that we don't encounter families who say, we wish that we had these resources earlier. So we are trying to get that message out. But I appreciate you saying that because we hear it a lot and we're really trying to change that dynamic. Tamara?
Yes, I just wanted to piggyback on a comment that you just made about outreach and talking to other parents. I remember when I started my journey, we did not have a lot of resources years ago. So a lot of information came from talking with other parents, and we actually formed a bond and formed a relationship that has grown as our children has grown. But it all started with just sharing information and having that outreach. And I guess in a sense, I was building communities at that time and did not realize it, but it has really flourished over the years. So that played a very big part in in my son's journey.
Me too. I also have children with a variety of different needs, and I know someone here had indicated they were part of a foster adopt organization. I also was a foster and am an adoptive parent, and community is what helped me survive. People that knew, what I was going through, that could provide information, but also support. And I think most parents, even parents with neurotypical children, need that kind of support, especially now as we add COVID, monkeypox, whatever to the equation. It's really hard out here. Anybody else want to comment on the video? That video is from Texas and their efforts to improve medical homes and services for their families there. All right. So we're going to talk about being an advocate because in order to set up a medical home, you, as was expressed in the video, you as a parent or a family member need to really advocate for your child, their needs, your family's needs, and then, advocate for the changes that need to be made. The medical professionals have a part in it, but you saw or you heard some of the obstacles that medical professionals are also facing in terms of time, money, and also just knowledge, just not really understanding the concept or seeing the value until families share it with them. So let's talk about being an advocate for just a second. So advocates, as you may know, speak up for themselves or others to make things better. Pretty simple. I want you to think about, you don't have to write it down, but just take a second to think about one way you have advocated for yourself in your life and one way you have advocated for somebody else in your life. So think about a time when you had to speak out and advocate. So we're just going to take a few seconds. You do not have to share if you don't want to, but I hope that some people will share their advocacy efforts. So if you have an effort either in for yourself or for somebody else, please just raise your hand.
Okay, it got quiet in my house now, so I can speak. So, I've been advocating for my 7-year-old um since he was, I guess he was like 2.5. And that's when he first started with the Birth to Three program due to a speech delay that he had. And then after that, just trying to figure out and connect all the resources and pieces for him, because there were different things that were coming up as he got older as far as his sensory processing, and trying to figure out and going through like evaluation and assessments. And you kind of get frustrated because I probably a lot of people have experienced like the resources are not always there with everyone, and connecting it's just so hard and frustrating as a parent, or even just someone, even if you're not a parent, you're just trying to help someone else out. It's like no one has the information, or they have it and they're trying to like keep it or something. It's just so frustrating. So just trying to advocate within the school systems, even at the therapies and the doctor's offices, it was just very frustrating. So like I said, I think I've been kind of getting my medical home together for my son for a minute, even like even his educational stuff, like just putting everything in a binder. That way, when I'm going into the meetings with them, I'm not forgetting anything that I wanted to speak about. I have all the records of the therapies, and the therapists and the doctors and who he went to see and so forth. So, just so that I can, keep I know what I'm talking about, and that way, whatever they're telling me and whatever information they're telling me, I'm putting it all together, and really making sure that I'm getting the best services for him, and that they're providing the best services for him, especially the ones that they said that they would do, some that he has the right to, and so forth. So, like I said, I've been really advocating for him since he was 2, trying to make sure that he gets the care that he needs. So that's kind of like my advocacy journey.
Thank you. And has your advocacy changed, do you think?
Um,
So
I
as he's gotten older, or
uh-huh.
as you have gained more experience, do you think it has changed or shifted?
I think it has shifted. I think it has. I've learned a lot more. I learned, different ways to do it, especially being a part of the partners in policy making class during the pandemic. It definitely has shifted as far as um, what I have the right to do as a parent, what I should be saying or asking for that I probably wasn't before. Um, and I just feel a little bit more organized as far, going into the meetings, and they can actually, they see that his medical team and his educational team does see that too. Like, when I come in, don't play with me. So I think it has shifted as far as definitely the rights that I have and my son has.
Awesome, thank you. Ada?
Hello. So my experience with advocacy has been different. Um, it hasn't been so much with the medical side as it has been with schools and agencies. My son is 16. Um, he was diagnosed officially with autism, and at the time PDD-NOS, which is pervasive developmental disorder not otherwise specified, when he was 3. Um, and I find that for us, it wasn't, like I said, it wasn't our doctors where I had to advocate from there. We had an excellent team. It was kind of the supportive agencies that were supposed to be helping that I just felt that weren't. So it was kind of difficult when I'm trying to figure out where I fit in and how to move. And it appeared as though sometimes the agencies didn't know where I fit in or how to help me. So out of that, I created my nonprofit Jay's House to kind of support families where I felt like I needed this support at the time. and to empower families to advocate for their children. So definitely has changed over the years. My thought process is different as far as IEP meetings and how to advocate different and for him. And I also wanted to say to the young lady who is at Nemours, where you said your doctors don't communicate. In some cases, you have to promote that on your end. I experienced that. My son has about somewhere between 6 and 8 doctors, but in my app, everybody communicates. But I put that out to each specialist as I saw them, like, hey, you need to communicate with this one. And some of them I didn't have to do it with. So maybe that's something that you can, convey to them, like, hey, I don't want to have to keep telling everybody the same thing, especially if I'm seeing you for something that is connected to what one doctor saw for. So like with my son, his cardiologist is connected with his general what is he general surgeon. So they communicate, and so does this orthopedic doctor, but they all communicate. But again, that was a conversation. I was like, hey, can you convey that to them before I get there? And that's how that went. But all in all, I think it's a learning process for all of us in this advocacy, and how to maneuver through, and that's what we do to help. So that was my experience with advocacy.
Ada,
Yeah.
do you think, have you been able to connect your medical home with your educational, your school district and the education for your son?
Well, my son is not in school in a district. He's online, and I pay for school for him to be online. However, my past experiences with my medical home and schools haven't been the best, only because of the educational / medical diagnoses being different.
Mm-hmm.
They kind of don't want to hear about his medical unless he's educationally diagnosed, which my son is, but at the time it was offered.
Mm-hmm.
Now I've heard a lot of people and families complain that is become a bigger issue, and with the lack of resources for educational diagnosticians,
Mm-hmm.
that is kind of making it a little more difficult.
I'm
So
glad you
here
said
we're
that,
talking
Ada.
about the
I'm glad,
medical home,
yeah.
but just keep in mind that there's also that educational piece.
Okay.
And you should be able to bridge your medical home with your educational home, or your school district, all of that. If you can't, there is an opportunity also for advocacy, because those two things work in connection, right?
Right.
Together. And we'll
Well,
talk
they
about,
should.
they should. If they don't, then that is an opportunity for some change, right?
Right. And that's what we've been finding, like at Jay's house, with the medical home piece. Like that seems to be the bigger, like one of the biggest issues we encounter, bridging that gap with the schools, because the schools typically don't want to, the schools typically don't, it's not that they don't care, but they make it seem like, hey, that's not important if he's not educationally diagnosed. If he's educationally diagnosed, then we can talk about it. You know what I mean? So maybe there is room for us to figure out how to tell families, or how to get families to convey that to them, so that the districts know that we know what we're talking about. Because essentially they come at us like we have no clue as to what's going on.
Exactly.
And that they're the only ones that know. So when we sit down, we have to be able to say, oh, no, I know that as part of my medical home process, his or her education, and in addition to the medical piece, all should be coincided together, right? Because what you see in a classroom, the doctor or one of my specialists may need to know what you're seeing in a classroom that I'm seeing different at home. So I think it's just a point of us trying to figure out, a way to convey that, and
Mhm.
maybe it be some kind of template like, hey, so they know what you're talking about.
Yep,
So I
and
think,
even just aligning therapies and,
yep,
yeah, getting everybody on the same page.
yep.
Um, I think Kathy was next.
Yes, when a couple of people were talking about Nemours, I Googled, like a case manager, because when I was going to the University of Pennsylvania for dental work, I was given a case manager. So there is a free service that Nemours offers. It says for if you're overwhelmed or you have multiple providers and you want to coordinate things, it's a free service. The phone number is 302-298-7719. And they will, it's the case management program. You could Google it.
Thank you. Also, if you have Medicaid, so as part of our Delaware Family Voices, one of our objectives is to assist families with MCOs, with conversations, with information, and that process. So you should have a case manager if you have Medicaid in Delaware. And if you're having any specific problems, have questions, are fighting an appeal or want to file an appeal, we have an MCO call every month that you can actually talk to the representatives, get some of your challenges at least discussed and solved, and connect with the case manager there as well. So that is a resource as well for you. Kathy, did you want to add any more?
No.
Okay,
Thank you.
thank you. Tamara? Or tomorrow, sorry.
Sure. So one of the examples I wanted to just share was that I had to advocate for my son once he exited high school. It seems like there's a lot of support when our kids are in school, but once they enter into adulthood, it's like, okay, where do I go now? And he was utilizing AI DuPont for blood work, and they allowed him to go up into the age of 21. So once he turned 22, I had to advocate for our local hospital, Bay Health, to see what services they could provide for him and make sure that those services were, made him feel comfortable, made him feel safe, and also, made sure that the people who were working with him were aware of his disability and had some type of knowledge. So I organized a collaborative meeting with the outpatient services who offered suggestions that we could try with blood work. And lo and behold, he's fine with blood work now. Before, it took 2 or 3 people to hold him because they just didn't have the knowledge, but they have really done a lot of work to be able to provide services for our kids. They also now have a sensory room in I believe it's the Dover, and I believe Milford has one as well. So when our kids have to go to the emergency room, rather than sitting in the emergency room for hours, like we usually have to, they actually have a sensory room where our children can go and they have sensory toys, padded walls, and things of that nature too. So that was just one case where I just had to advocate to see, as far as getting blood work done, how can we do that now that AI DuPont is not an option? And so far it has been working very well.
Thank you so much. We actually are going to have a parent panel at our summit, and I would love to talk with you about being a part of that, because one of our focus in Family Shade and in our F2F, our Delaware Family Voices, is the transition from pediatric medical to transitioning to adult medical care, and
Right.
what that looks like for our children and how to make that process better, what concerns parents have and what our facilities here in Delaware are doing. And I do want to say, Nemours, from what I've heard in my own experience, has a fairly good model. There are still some challenges, but a great model. But recognize also that some people live in Sussex County, or in other areas where they can't necessarily access Nemours easily, and are working with different healthcare facilities. So it's not just Nemours. We do want to promote medical homes for all of our institutions, and also our psychiatric institutions and other places where our children might be receiving services. But thank you so much for talking about that transition, because that is also very important for us and very important to advocate in that instance. And my son, who is 11, also has the same challenges with blood work. It is always difficult. And I can't imagine what's going to happen when he's 19 and we can't access the services. So I completely relate to that and what you're talking about there. Latanya?
Hi, yeah, I wanted to mention about the cross between the education and the medical connection. And with my son just being diagnosed with ADHD, the psychologist, or she was telling me that continue to do the therapies outside of school, because all the school cares about is if your child can sit still. And, you know, with the different evaluations and so forth that I had to go through during this past school year, there were so many times that he had to be out of school. And I tried to explain to them, okay, but this is what I'm doing on the medical end because he's having so many issues in school. And, you know, they sent me a letter stating all the days he was out of school. And I'm like, okay, but how can we connect the two together? And, you know, basically from what the doctor told me, that the school doesn't really care about that. As long as your child can sit still, that's all they care about. So I would love to, you know, start advocating for that, because that's the main thing. If they're not in school, they're not, that's a part of education that concerns education. They can't get the education because they're outside of school so much, taking care of that. So there is a connection. And I would love to start advocating for that.
Awesome. Yes. I would say just be careful. You know, every system has people that are very passionate and committed to helping, and others that are not. So, you know, I was a teacher years ago, a special education teacher, and I cared, you know, it wasn't about if my student sat still or not, but the system is not designed to work well together with the medical system. So, you know, what you're hearing from administrators, from those who set the policy and the rules in the school system is very different from what you're hearing from the medical professionals. So, you know, and I understand teachers and therapists that are caught in the middle, where they really can't advocate fully in the way that they would like to for the children in their care, but they can see the problems. So just wanted to say that. But yes, there does need to be work, I feel, advocacy on matching those systems so it is a complete medical home with the participation of the school and educational facilities that your child attend, with the medical piece as well. I think Kathy, did you want to add?
No. Thank you.
Oh, no. Latanya?
Oh no, I just think that I raised my hand.
Okay. All right. So let us talk about some ways to do this. So I love this quote by Alice Walker: "The most common way people give up their power is thinking that they don't have any." Okay, so we always talk to our parents about this, in that you have the power. A lot of the systems are designed to make you think that you do not. But what we know is that you are your child's first teacher. You are your child's advocate. You know them the best, and you have the power to affect change. So, why would we say you need to be an advocate? Well, your experiences as a parent, family, professional are valuable and can be used to improve things. You know when something is or isn't working. You have ideas for how to make it better, and you have the only long-term connection to this child. So just once again emphasizing how critical you are in this process. So here's some skills to be an effective advocate. And we have another training and webinar that focuses on advocacy skills specifically. But here are some skills: understanding your child's strengths and weaknesses and their disabilities. So some people talked about, Griselle Vanessa last night was talking about some people do not understand their child's disability. And that is critical to understanding, number one, if there is a disability and what type of disability, and all of the information about that disability. Also knowing the key players. So in this case, knowing the key players in the school system, but also in the medical system. So who is your child's general practitioner, specialist? Who do you go to if you're having a concern in terms of insurance and services? All of those key players, knowing your rights and responsibilities, becoming well organized. So we've had a couple of people talk about that. We will be doing a care notebook session at our summit, and also probably will make that available in Spanish and Haitian Creole as well. Also using clear and effective communication, and then knowing how to resolve disagreements. So all of these things are going to help you become an effective advocate. So let's talk about communication in terms of a medical home. Understand that strong communication with healthcare professionals doesn't happen in one visit, but it develops over time. So in the video, they talked about, you know, if a professional, a medical professional, has seen your child since they were 3 and they're now 17, they're going to have a much better relationship with you, the child and the family, and understanding, and be able to really put that medical home model into practice. Sharing information with your child's healthcare professionals. Okay, so making sure that you come to your visits with the topics you want to discuss, you ask questions, and you take notes. Okay, so don't just be passive, but definitely be active in terms of getting the information, asking the questions, and sharing your concerns with your medical professional. Getting information, getting more information. So healthcare professionals have handouts and they can guide you to other materials, but also the Parent Information Center does, Autism Delaware, lots of different, you know, the different MCOs. There are lots of different places that you can go to for information depending on your child's disability, their age, and the kind of problem or challenge that you're having. And then ask what is likely to happen in the next phase of your child's development. So, you know, as Tamara was talking about, like, you know, me right now, I have a 17-year-old. I've never had an adult child. So I don't know that next phase of development, the next phase of medical care, the next challenges, I don't know what those are. So I need to talk with our medical professionals, also parents in the community, also, you know, educational professionals, to begin to plan and prepare for that next phase. And, you know, all throughout our child's life, we will be doing that. And then find out when and how to contact your healthcare professionals between visits. So some of you have mentioned Nemours, which has an extensive online health record system. Some other hospital systems do as well. If they don't, how do you contact your healthcare professional when you need a referral, when you need to just talk, all of those kind of things. And if there isn't a way, how do you set it up so that there is? And that is what you would be advocating for, not just for yourself, but for all the families that this provider works with. So one of the most critical things that is talked about in there is organization. One way that we can improve organization is but through a care notebook. So a care notebook is a notebook that has all of the documentation that you get for your child if they have disabilities. And it is organized in a certain way, and it has certain information. Our care notebook also includes information about the child's education. So their IEPs, their 504s, their discipline information. All of that is also included in the care notebook. So a care notebook is going to help keep everything organized and easy to find. So when you're away or short on time, the care notebook will give caregivers the information they need to best take care of your child. So I always say when we're doing this, imagine if you were in an accident, not fatal or not significant, but say you were away from your child overnight unexpectedly. Would your community know how to take care of your child effectively? Would they know the drinks that your child can and can't have? Would they know the binky or the blanket that your child needs? Would they understand the person that can help calm your child if you don't come home? Those are the type of things that you need to put in a care notebook. So if I gave this to somebody, they would be able to piece together what this child's day looks like, what are the important things medically, what they need, their medications. All of these things would be in a care notebook, but it also contains information about visits with your medical home, about referrals, about equipment. So what if your child's in the care of their grandmother and a piece of their wheelchair breaks off? Are you going to have the information for that to be fixed quickly in that notebook? So there's a lot of things that sometimes you don't think about as a parent, and this information is kind of scattered about your house or in your computer or in your email, but really pulling that together so someone would be able to have that if they needed it. And we include all the educational pieces. So what is the transportation that your child uses? What are the supports in the classroom? What are the things that have to happen every day for your child for them to be comfortable, or as comfortable as possible? If your child has an emergency, the notebook can help first responders know their important medical information, whether they have a feeding tube, their communication device, all of those kind of things, right? So here are some resources, and I will send you this this PowerPoint, but there's a lot of resources in putting together a care notebook. As I said, we are going to go through it actually physically, so we'll put together the care notebook together and talk about it, and there'll be some giveaways and surprises for you, but we're going to do that, but also, want to give you some of these tools so that you can begin to gather this information together. And you'll notice that it is that it is from a variety of different healthcare entities, but also from emergency um, services, right? Because what happens if there is a weather emergency or a health emergency? You know, are you going to be prepared? Is your child going to be prepared? And then we have some other things, but I'm going to stop here because we are at the hour. And Jaleesa has put up the poll. If you could please quickly fill this out, and then we are going to put up the evaluation as well, which is just a few more questions. That would be really helpful for us. And Kathy, do you have a question?
No, I just wanted to say that I think it's really important that the notebook be kept up to date, because when I was taking care of my dad, I was shocked at how out of date things got so quickly. Different medications, different treatment regimens. So go over that
Yes.
notebook periodically.
Yes, and we suggest that you periodically basically put it into your schedule. So I know, for example, right now, a lot of people are preparing for the next school year. So this might be a time to go through your care notebook. There's a sheet in there that is like an about me sheet that is your child fills out, that you put a picture in. For anybody that is looking through this notebook, now might be the time to do that in preparation for new teachers, new whatever. So just having certain touch points in the year where you go and update that information. Yes, that is critical.
I want to thank you because it has been an amazing amount of information, stuff that I wasn't even aware of that I'm going to be sharing with the people that I work with. And I think it's pretty amazing. And thank you so much for inviting me.
Oh, thank you so much. And like I said, please just hold on for a second. We are going to put the evaluation up so that you can just give us feedback like you did on what you thought of this session. And we will continue to provide sessions like this. And then, so let me put this evaluation up. All right, it should be up. It is just 4 questions specifically about this webinar. And then you can go. We will not have a family leadership training and learning community next month because our summit is at the end of the month on September 29th. You will be receiving information about that soon to be able to register. And if you are part of an organization that would like to have a vendor table, we will also be sending out the vendor application.
Christina, this is Sonia.
Hi, Sonia.
Hi, I want to apologize when you were trying to get me to talk before. I was driving, so my phone would not turn my microphone on.
I
but
understand.
I've been here the whole time.
Good. Sonia,
So
you just want to introduce yourself?
Sure. So my name is Sonia Dyer, and I am a social worker at the Dover Air Force Base. I work specifically with families who have dependents of all ages with a very wide variety of special needs, medical and educational, et cetera. And this training has been very, very helpful. I would actually love it for somebody to come and talk to my people here about it.
Sure, you know,
so I know that they're there, not just me saying, hey, this is a good training, but but thank you very much. It was very, very interesting and very helpful.
Good. Yeah, we would love to come. So just send me an email and we can set it up.
Sounds good. Thank you.
All right. All right. Well, thank you guys so much. I appreciate all of your participation. And as I said, we will send out follow-up information, the PowerPoint, and then information about our upcoming summit.
Thank you very much.
Thank you, Tina.
Thank you.
Thank you, everyone.